Hi, this is Dr. Frezza at the Chiropractic and Injury Center. Today we're going to talk about the criteria that we use to measure patients' progress. So there are three criteria that we always talk about with the patients. The first one is obvious. Most of the patients who are coming through my door are coming in because they're in pain. So my primary goal is to get the patient's pain level to drop and to get it to drop consistently. What we find most of the time is that's fairly easy. Right? Most patients, somewhere in that 10 days to 2 week frame, are going to start to feel better, and they're going to start to feel better consistently. So that's the first one. The second one is we want the patient to be able to function optimally. Okay? They need to be able to go to work. They need to be able to take care of their family. They need to be able to maintain their property, their house. That's a little bit trickier, right? The way we set up our care plans, we do them over the course of 90 days. Somewhere in that, that 6th to 8th week is when we try to make sure that the person is functioning optimally. All right. The last one, and sometimes I think it's the most important one, has to do with the x-rays or the films. We take films on just about everyone who walks through the door. We try to find out where the films have gone awry, where the problem is at. And then my goal is to have the person feel better, but also to make sure that those films change, that we fix the problem. I always use the analogy of the orthodontist, right? If you have braces on your teeth for 2 years, 3 years, and the orthodontist removes the braces and the teeth are still crooked, you didn't really do anything. Kind of the same thing here. We want to make sure that the films change, right? So that's important. So we do a set of films at the 1 month mark of our 90-day care plan. Again, making sure that things are starting to move, and then at the end of our 90-day care plan, we take the films and make sure that we hit our targets. So there are the three criteria. Again, making sure the patient is feeling better and feeling better consistently, making sure that the patient is functioning better, and then ultimately making sure that the films are better, that the films have changed. The ultimate goal then is to get the person into a monthly maintenance routine, and that's the final goal that I have for all of the patients, and that's something we're going to talk about in another video. Again, this is Dr. Frezza at the Chiropractic and Injury Center. Thanks for watching.